When you come to see me, I'll use 2 fingers so you get a second opinion. So, well, anyhow, it was a pleasure to be here, and really thanks to the organizers. I think it's a great thing that you're doing up here for the community, and it's wonderful to see such a great turnout. I'm going to touch on prostate cancer a little bit, and I'm going to talk about men's health in general and some of the work that we're doing through the Canadian Men's Health Foundation. And hopefully, at the end of this, you'll get an appreciation of why I'm doing this as a urologist and what exactly we're doing. So let me move on here. Let's start by asking, what is men's health? If I go out on the street and ask somebody what men's health is, the sea of noise that comes to men's health with like hundreds of Facebook postings every day and every week. And, people will say, oh, it's about abs and about sex and about this and about that. But, really, what is men's health? In China, this is men's health. They have hospitals that are dedicated to males alone. Okay, I haven't seen that yet in Canada. And through a urologist lens, my kids call me a pee-pee doc, we focus on prostate issues, prostate cancer, BPH, which is benign growth, infections of the prostate, erectile issues, infertility issues, penis issues, testicle issues, all this stuff below the belt. That's what we do. That's how I make my living as a urologist. But is that men's health? I call it men's urology health. So many prostates, so little time. This is the lineup outside my clinic. But I'll put to you, and the golfers in the room will appreciate this, men's health is more than a prostate and a penis. In fact, I was quoted by the current Prime Minister in the House of Commons saying this. He said, Dr. Goldenberg has said that men's health is more than a penis and a prostate. This is read into the Hansard. So if you were to go to Ottawa and search for penis in the Hansard of the legislature, you'd get my name. And it really is more than a penis and a prostate. And this is really where I'm going here. It's about mental health, post-traumatic stress issues, hormone issues, cardiac issues, skin issues, bone issues, social determinants that impact on our health every day, family issues, youth issues, behavior, and so on and so forth. It's huge. It's an enormous area. So why do we want to focus on men? Okay, well, I think the main problem with men is that when they transition from teenagers to young adults and go out university or to work, mom is no longer there to take them to the pediatrician or the general practitioner. And they won't go to a doctor unless they break their arm or they need their appendix out. There's that lack of transition that we see in the female side where they continue with physicians because of pap smears and birth control pills and so on and so forth. So we lose that. There's that big gap in the male trajectory as they go from teenagers into adulthood, and they don't catch up for many years. And a lot of the risk factors that I'm going to talk about later, whether it's diet or lack of exercise or smoking, still more prominent in men. Now, women aren't saints. I mean, women have got problems too. And I'll tell you over and over again in this talk today, this is not an issue. This is not a competing victims discourse. Okay? It's not about men versus women. Right? This is about men's issues and how it fits into the family, as my title slide said, in the well-being of a family. The financial side I'll touch on in a moment. This is just an example of men's, I don't know if the pointer, can you see the pointer there? Yeah, there we go. So this just shows men's healthcare use of the healthcare services over different ages. So the blue is women, the green is men. So when you look at it overall, women attend to healthcare visits more often than men do. But the real differences are here in the ages between 15 and 45, as I was alluding to. That's where the big gap is. Women continue to attend to health services, so they know about prevention, they know about what they can do to help themselves and to help their husbands or their brothers or their sons. But men don't. And that gap is something that we really have to address. So over the last 100 years, this is life expectancy data from British Columbia. Over 100 years now shows a steady increase in life expectancy in both genders. So we're all living longer. The average life expectancy is increased. The difference actually narrowed a little bit in the 1940s. And remember, I'm talking about average life expectancy. So average means over the entire span. So the fact that men are dying on average at a younger age than women means that something is causing the numbers of men to die at a younger age to bring the average down. Now, I once asked a guy, why do men die before their wives do? And he said, because they want to. Okay? But I don't think that's the only reason. And so we did a study, and we reviewed a lot of statistics and across the nation with looking at all kinds of papers and stats. And really the numbers, there are three major reasons that account for this difference in life expectancy. And remember, it's average life expectancy. So with cardiovascular disease, it strikes men more often at a younger age than women. Women are dying of heart attacks, and they have strange symptoms. It's a whole different issue. But if you look at this gap here between 35 and 45, you can see that more men are dying. If a guy has a heart attack at 40, he means it, and he's gone. But then as we go beyond 45 and 50, the two lines are parallel. So the difference is the gap isn't. But again, it's an early age issue that brings the average life expectancy down. Suicide, depression, suicide. Men carry out suicide 3 to 4 times more than women do, though women attempt suicide more often. So, you know, with many females, it's more of a call or a plea for help, and they'll take some pills or something. If a guy decides he's going to kill himself, it's a gun or a noose or jumping off a bridge. And men use major lethal methods. But you can see women are dying from suicide, but there's a huge gap. Again, in the earlier years, that gap is particularly prominent. So again, that brings the average life expectancy down. Motor vehicle accidents, guys have it may be a social construct. Boys are tough, suck it up. Men don't cry, be tough. That is a real issue of masculinity. Also, our culture, our attitudes towards men just promotes this lifestyle of, look after, women and children and go into lifeboats first. Rewards outweigh risk, addictions and habits. And then there are all the myths out there. People go to hospitals to die. Surgery spreads cancer. If they find something, there is little you can do about it, so why bother? That's just the male brain. I think that's really what it boils down to. Okay, especially in that 25 to 40-year age group, this is what the man's brain really looks like. And I want to point out the footnote in case you can't read it. It says, the listening to children cry in the middle of the night gland is not shown due to its small and underdeveloped nature. Best viewed under a microscope. So guys also take risks, all right? This guy here, he's not going to live too long. He's going to irritate that tiger. So men just engage in more high-risk activities and sports, more sexual partners, violent behaviors, drive drunk more frequently, more alcohol and tobacco use. These are just facts. Are men stubborn, stupid? Are they both? So this sign says, this year thousands of men will die from stubbornness. And somebody wrote, no, we won't. And the ultimate recent illustration of men's stubbornness and stupidity. Okay? This is what I'm up against, and some days I think, why am I bothering, So awareness of the problem. As a society, we seem to be unable or unwilling to see the fact that every year millions of Canadian men go missing from our daily lives. And they're not dying, but they're just becoming ill or frail, and they can't be for us. They can't, society just accepts this as phenomenon as being normal. And, it's too bad because it's eroding the vitality of our lives and of our families and our communities and our economy. So it's a big problem. From an economic point of view, we did, our Men's Health Foundation did an economic analysis a couple of years ago, and just looking at the 4 significant risk factors of chronic illness: smoking, excess weight, alcohol, and lack of exercise. These 4 things alone contribute to 40 or more different chronic conditions. And it's estimated that 75% of chronic illness in the elderly can be modified or even prevented by modifying these risk factors at an earlier age. So there's an opportunity here. We can make a difference. 53% of Canadian men a few years ago carried excess weight. That number is probably higher now. 40% inactive, 20% still smoked, 12% consumed huge hazardous or harmful levels of alcohol. And the economic burden, $36.9 billion, attributed just to those 4 risk factors and the chronic illness that comes from them. That's a big chunk of money. I call it a 5-to-1 scenario. If we were to reduce these risk factors by 5% in year 1 and 1% per year thereafter, over a course of 20 years, the cost avoidance would be $67 billion. Again, something we can do. So, in the simplest of terms, we formed this NGO, the Canadian Men's Health Foundation in Canada, to fill in a missing piece of the puzzle of family health. And if we think about family health as women's health, children's health, minority health, and men's health, it's really a full puzzle. It's the whole picture. So we need to address all parts of that. So as I said earlier, it's not a competing victims discourse. It's not about women versus men. It's about fitting in that last piece of the puzzle. And it's just as important to women and to girls that their fathers and their husbands and their sons are healthy as it is that they're healthy as well. And we have to figure out, how can we make this a habit? And when we have, in our society, we can advocate for polar bears. We recycle. We do all kinds of things that are important to our environment and to our communities and our societies. So why can't we create a social movement for men's health as well? So it should be a habit, so it becomes instinctive, accepted, expected, not the way it is today. So the Men's Health Foundation, our main goal basically is just to get guys aware and to move them to action. So get their attention, get them thinking, get them talking, get them knowing, and finally get them acting. And it ain't easy, because men are generally tuned out. How many women in the audience appreciate this? So how do we talk to men? I mean, we want men to live active, healthier lives. And, don't get me wrong, there are a lot of guys who are very healthy, okay? But remember the statistic, 50% are not. In that age group, our target audience of the 25 to 45, 50-year-old, there's about 5 million men in that age group in Canada, okay? So if half of them are healthy and half of them are not, we're talking about 2 to 2.5 million individuals who are going to develop chronic illness, die young, and be a burden not only to themselves and their family, but to our entire society. So how do we talk to men about their health? Is it possible? Can we do this? I've got bruises on my head from knocking my head against the wall some days wondering about this. But I think I look back to Dr. Seuss, and those of you who have children and grandchildren will recognize the green eggs and ham story. I could not, would not, I will not, I won't, blah, blah, blah. That's men, right? I won't. I got other things to do. Sam, if you let me be, I will try them, you will see. I do so like green eggs and ham. Thank you, Sam, I am. I think we can get there. And we hypothesize that if we can identify how to talk to men, and if I have a message I want to give you, like lose weight so you don't develop diabetes and lose a leg and your sexual function, I mean, a simple, little message like that, I have to word it in a way that that man and that man and that man will not just hear it, but absorb it and understand it. And that man and that man and that man hear and listen very differently based on their morphologies, on their worldviews, on how they see themselves, how they view health, and so forth. So we need to develop something what I've called precision or personalized communication. In medicine now, you'll hear a lot about precision medicine, right? We look at the genes of a cancer and the genes of a person, and we try to identify the right drug that will work just for that individual in a precise way, because not every drug works the same for every man or woman. So we need to develop precision communication. They've been doing this in the retail industry for years. If I'm Holt Renfrew and I want to sell a blouse to a certain demographic of women, they're not going to create an ad to catch my attention, right? You've got to focus in. You've got to be precise. And so there's been practical applications of psychological tensions and this and that. Anyhow, I'm not going to go into this in great detail, but we were able to, we haven't published this yet, but we have identified about 6 different conceptual themes or modes for men. So some men deny vulnerability. You know, these are the guys who, you know, they want status and youthful power forevermore. They're worried about their, you know, they need a six-pack and thinking about sex day and night. You know, or there are guys who are very balanced. They do the dishes. And then you've got guys who delegate the responsibility. It's okay, my wife's going to take care of it, or my mother will take care of it, and so on. So we can identify that, and a major goal is to take the messages that you hear from all societies, healthcare societies, the cardiology, you know, the Heart and Stroke, the Diabetes Association, the Mental Health Association, and apply it to these different morphologies. And then on top of these individual morphologies, we have all the ethnic issues and the racial issues and the geographic issues and so forth. So it's a huge job. But my attitude has been, we've got to start now. And we've got a pretty good team working together to try to get this messaging out and to work on the messaging. And I'll give you some websites and stuff if you're interested to look at it. But in general, when I go to talk, people, you know, particularly younger guys, don't want to listen to me. So we've got champions. And our men's health champions are well known to many of you. In Canada, we sort of focus a little bit more on hockey. But we have people like Ned Bell, who's a famous chef. He's written great books about preserving the ocean. Shea Emery is a football star. Adam Creek's a great Olympic gold medalist, and so on. So these people go out and they're helping us. They speak to groups. They are helpful. But I think that the main thing that I'm excited about is our main branding, our main campaign called Don't Change Much. Guys don't want to be told, do these 30 things and you'll be fine, all right? Let's just do little things, small incremental changes. You know, take the stairs instead of the escalator. Park your car an extra block away from work. You know, get off the bus a little bit earlier and take a little extra walk. Small little things. Half fries, half salad. 2 beers instead of 3 beers. So little changes. These small incremental changes will become habits and eventually will coalesce to become permanent behavioral changes. And their potential downstream impact is huge. So the Don't Change Much campaign to me is very, very important. And we've tried things like, you know, advertising. So here, get healthy. You've done way harder things, you know, putting together a barbecue or, you know, the remote control. Well, that's a lot harder than modifying your diet, right? And we've had, this is a video that played on TV as well as at hockey arenas on the Jumbotrons. I'll see if it'll play here.
Lately I've been thinking about making some changes in my life. Taking a new approach, changing my ways. Little stuff, you know, like taking the stairs once in a while. Drinking more water. Or swapping fries for salad sometimes. A few small steps like that will make me feel better now and down the road. I mean, I wouldn't want to be a burden on my wife. Ain't that right, honey?
Change, but don't change much. Get simple tips at don'tchangemuch.ca.
You know, that's the kind of an ad that we have a number of those to try to catch guys' attention. Humor goes a long way in communication. Okay, well, It just keeps going over and over again. There we are. The other thing that we've developed is a tool that I would recommend that you go to our website. You can go to ucheck.ca. This is a self-risk assessment tool. It takes about 10 or 15 minutes, and get your sons to do it, get all the guys that you know. And what it does is men wouldn't go to 6 different websites to determine what their risks are for 6 different illnesses. They might do one, but that's it, right? Forget it. Attention span is like that big. So we put it all together in one, and it's the only one in the world. I was surprised that no one had ever done it before. And it took 4 years to develop and to validate both internally and externally. So it's fully validated, and we've got 6 different illnesses. You answer a series of 35 questions. It takes about 10, 15 minutes, and then it'll spit out the algorithm. The computer algorithm will tell you what your risks are for these different illnesses: cardiovascular disease, diabetes, sexual dysfunction, prostate cancer. And then it's up to you. If you get nothing but green lights, you're cool. Continue on, you're doing well. But if you have a red light, like if you get a warning that maybe you're at risk of a heart attack, it's up to you, but you may want to look into it. Of course, it's up to you. We're not forcing anything on anybody. Don't change much. All right, and when we went back, we've monitored something like, I think it's 26,000 men who have completed this. These are the numbers this is crazy. 72% are overweight, obese, or extremely obese. 3/4. 54%, so just over half, had normal blood pressure. 14% never knew what their blood pressure was. Go to Shoppers Drug Mart and put the blood pressure cuff on. It's not a big deal. Know if you have high blood pressure. Do they even know if they have a family history? I looked down there at family history. 18% of the men didn't know what their family history was. So 1 in 5 guys don't know what their grandfather died of. So I tell the young guys, speak to your grandfather while he's alive. Speak to your dad. Find out what illnesses run in our family. What am I at risk for? We've just put this out. This is called Ishi. Ishi is a play on words of some African term. I forget what it means. I'm sorry. I should know. I'll come back to that. I can't remember. But this is for women. So it's the same thing. We've put together, working with the Women's Hospital, we've put together a questionnaire for women. So this is, I'd appreciate if you go on, if the women go onto the line. This is brand new. This is just out. So it's ishi.ca. Go there and try the risk score yourself, okay? So the way we've structured Canadian Men's Health Foundation is like a hub and spoke. So we have the hub, the Men's Health Foundation, and we have our programs. We have the Don't Change Much, we have UCheck, and now Ishi. We have a Men's Health Week every year. We have a men's initiative run by David Cool. I'm not going to touch on that. Physician training guidelines that have been put out for GPs. We have a Hat Trick program, which is a hockey club-based health program for men in the communities. Dudes Club, which is addressing the Aboriginal community in downtown East Side and is now spreading across BC. An in-depth information resource which will be open online in December called Manopedia. So, and this will expand, so we're growing. So I don't know, how much time do I have, Jane? Where's the hook? 15 minutes? Okay, perfect. I was worried that the hook or there was going to be a hole in the ground here or something. You okay so far? We okay? Okay, so, because I wanted to veer a little bit away, and because many of you may have thought as a guy who does nothing but prostate cancer, may want to talk about prostate cancer. Well, I want to talk about prostate cancer. But why is a urologist talking about a men's health social movement? All right? Why am I just in the operating room operating on prostates? Well, urologists deal with men, boys and men throughout the life spectrum. And there are a lot of opportunities for us as urologists to address general health issues. And I give this talk to my colleagues in urology because I think that we can make a difference. We can recognize a lot of these underlying risk factors that may cause a man to come to see me as a urologist, but may also be an underlying risk factor for a heart attack or for diabetes, smoking, diet, exercise. And if we look down the left side there, those are a bunch of very common illnesses that I see. So sexual dysfunction, prostate cancer, bladder cancer, kidney cancer, testis cancer, infertility, LUTS is urinary tract symptoms from enlarged prostates and kidney stones. Okay, those are all very common. I'm sure there's at least one person in this room with at least one of these issues. And if you look across the top at all those risk factors and you see the X's, so you can see how risk factors go across the spectrum and can impact on so many different illnesses. So we as urologists have a lot of opportunities to engage. If a 35-year-old man is having a vasectomy, I don't need to talk to him about the BC Lions or the Vancouver Canucks or whatever. Should be talking to him about his family history and he's, does he know what his father and his grandfather died of? A 50-year-old with declining erections. Maybe he's a smoker. Maybe he's got diabetes in the family and so on. A 63-year-old with urinary troubles and so on. And I'm going to touch on I think one of our speakers is going to talk about bladder cancer in a 58-year-old. And I'm going to just touch on a 55-year-old man who comes to me with prostate cancer. So the opportunity for me that goes beyond being a urologist with blinders on, just treating the prostate cancer, I can talk to that man about smoking, obesity, alcohol, physical inactivity. How many of you knew or know that these risk factors are associated in some way with prostate cancer? You don't have to put your hands up. It's okay. Smoking. Does smoking increase the risk of prostate cancer? Yep. But even more so, it increases the risks of dying from prostate cancer. Okay? Not to mention the over 200% increased risk of dying of a heart attack or having a stroke if you're a smoker. So when you go to a 30-year-old and say, quit smoking because you're going to develop lung cancer when you're 60, they're going to look at you funny. But if you say to them, quit smoking because you're going to lose your erections in 10 years, they might think about it differently. Or prostate cancer. And if you quit smoking for long enough periods, your risk comes down. Okay, and I won't go into this, but there are people trying to explain why this is, what it is about smoking that increases the risks of prostate cancer. What about obesity? This says, it's amazing when you realize it takes an oak tree 200 years to attain that girth. Okay? I mean, that belly is prominent. And there's multiple studies, which I won't go into detail, with hundreds of thousands of men that prove beyond a reasonable doubt that having a lot of visceral fat, a lot of fat on the inside, increases the risk of not just having prostate cancer, but having more aggressive forms of prostate cancer. So what do you do about it? Watch your diet. We know that saturated fat, in particular, processed meats, are nasty for you. Not just for your prostate, they're bad for your colon, they're bad for your brain. In women, they're bad for your breasts. Barbecued and grilled red meats. So you don't have to avoid them entirely, but in moderation. Everything in moderation, especially moderation. Mediterranean diet focuses more on fruits and vegetables, legumes, nuts, a little bit of meat, but mostly fish, poultry. It can decrease mortality by 25% and even cancer mortalities by 24%. People ask me what kind of diet for their prostate. A healthy prostate diet is a healthy heart diet. Okay? It's also a healthy colon diet, a healthy breast diet, a healthy brain diet. What about alcohol? I'm going to skip through this real fast. 27 studies show an increased risk of diagnosis and mortality related to alcohol intake, and it seems to be the more you drink, the higher your risks. Okay? So less than 2 drinks a day, a modest increased risk of 8%, but more than 4 drinks a day, you're closing in on a 20% increased risk of diagnosis and mortality. Did you know that 2 to 3 glasses of wine per day can reduce your risk of giving a shit? This is for you, Tukey. I thought of you when I put that slide in. And lastly, physical inactivity. What fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? Simple message. If you exercise, you decrease your risks of developing prostate cancer. Now, if I said to you that I could give you a pill that will decrease your risks of multiple cancers, premature death, heart disease, diabetes, breast cancer, colon cancer, osteoporosis, depression, on and on, would you take that pill? Probably. Well, that pill is called exercise. So take it. And this has just come out in the last year or two, important forms of exercise. It's been proven from Harvard School of Public Health that the more you ejaculate, the decrease your risk of prostate cancer. and it's across all age groups, okay? So if you ejaculate 21 times a month, you can significantly decrease, basically by 60%, decrease your risk of prostate cancer. 21 times a month, not a day, Tukey, a month. So just to sum up, Canadian Men's Health Foundation, it's a social movement. If we don't start it, we'll never get there. It's a tough uphill climb. We're making progress. I have 15 people now in the Men's Health Foundation. I'm the chairman, but we have a great president and a vice president and wonderful people, and they're all young people who have drunk the Kool-Aid. They love working on this. They love the social media, and we're in a world of social media. So a lot of this is Facebook and Twitter and all the other, whatever, Snapchats and those sort of things. And remember, it's the final piece of the puzzle, okay? It's not a competition. We need to approach governments, we need to approach our public and make sure that people understand that it's not a competition. We need help from everybody. We need help from donors. A lot of this is philanthropic based. We've been helped by the BC government. We've recently got money from the federal government. We've got money from the Ontario government as we expand. We're approaching the Nova Scotia government, Alberta government. So it will become national, but this is born and raised here in British Columbia. These are some of the websites I'd suggest you go to. Our Don't Change Much is easy to remember, .ca. The U-Check, get your friends and sons and fathers to go there. Eshi for the female. And if you're on Twitter, at Men's Health Foundation. So again, men need their partners, so this is for the ladies as much as for the men out there. You have to control their lives. Thank you.